This week, we will be covering maintaining client dignity and ethics case study scenarios. This module will cover task list items F5 and ethics. It should be noted that this training program is based on the RBT task list and is designed to meet the 40-hour training requirement for RBT certification. The program is offered independent of the BACB. In regards to maintaining client dignity, we will be discussing a few suggestions of what you should do and some things that you should never do. We also have provided the references that we use to come up with these lists. It should be noted that we used a variety of references to come up with these guidelines. Finally, we will be going over an ethics review and case study examples. Now I will begin our discussion about maintaining client dignity. The following slides are suggestions of things that you should do. You should always give your client your full attention while you are providing services. While working in centers, in-home, and other settings, it can be easy to become distracted by what's going on around you. You should avoid having side conversations with coworkers or others. It is crucial that we focus on working with our clients rather than socializing with others or attending to other events in the environment when it is not necessary. Additionally, you should focus on the client by interacting with them frequently and providing learning opportunities as much as possible. When you are working with your client, you should be providing them with your full attention. This involves active engagement in the form of eye contact, instructions, opportunities for play and interaction, and so on. With all of our clients, it is crucial that we treat them with respect when speaking to them. If your client is verbal or nonverbal, you should treat them with respect while conversing. Even if a client is unable to communicate or does not appear to attend to language, it is still very important that we treat them with respect. This involves talking to them the same way you would talk to others while in a professional setting. Of course, your language should be age appropriate and/or developmentally appropriate to the client you are working with. Do not be overly aggressive by placing harsh demands, putting down their ideas or thoughts, etc. Instead, you should bounce ideas off of one another if possible or present demands and feedback in a non-aggressive tone. On the other hand, it is also important to avoid being overly friendly. If you are working with a 15-year-old individual who has autism, you should not speak to them the same way you would talk to a 3-year-old. You should always use age-appropriate language. Either of the above situations can make them feel uncomfortable, as they are receiving different treatment compared to those around them. This could damage the client-therapist relationship and cause them to feel isolated from you. Number 3, have empathy and compassion. You should be understanding of the parent's perspective. There are many stressors that any parent endures, especially when their child is engaging in problem behaviors or has skill deficits. Because of this, we should always be aware of their feelings and point of view. They are around the client more often than you are. A child who engages in high rates of problem behavior, for example, could cause a parent a lot of stress and may cause them to be skeptical of ABA, standoffish, etc. Because of this, we want to be conscious of their thoughts, feelings, and perspective. We should always be honest with parents about a child's progress, but should also avoid being overly negative. For example, when the parent comes to pick the child up from services, you should not make statements such as, "Wow, today was a really bad day." Constantly hearing these types of statements can be very discouraging for the parent and make them dread interacting with you. Instead, talk about the good parts as well as the not so good parts of the child's day. While you want to be there for the parents and always be supportive, there's also a line between being empathetic and overstepping boundaries. You must remember that you are not a therapist, therefore you should not be giving clients advice or therapy. Number 4, acknowledge differences. It is important to attain cultural awareness. You should always be aware of the cultural differences between you and your clients and their families. We are now going to watch a short clip that discusses cultural awareness.
One of the worst, yet easiest mistakes people can make is to assume that other people are just like them. People from different cultures see and do things in many different ways. Let's take a look at cultural competence. Cultural competence is the ability to interact effectively with people of different cultures. A culturally competent person has the respectful awareness and understanding of cultural differences. There are 4 components to cultural competence. Let's take a look at each. First is awareness of our own cultural worldviews and our reactions to people that are different. Next is our attitude towards cultural differences. This reflects a willingness to honestly understand our beliefs and values about cultural difference. Third are our cross-cultural skills. This component addresses the importance of practicing cultural competence, including nonverbal communication, to become effective cross-culturally. Although some people are more naturally culturally competent, most of us have to put an effort into developing this skill. This requires honestly examining our prejudices and biases, actively developing cross-cultural skills, learning from role models, and having a positive attitude about cultural issues. The key to cross-cultural success is awareness. Being aware of how culture influences your interpretation of others, your own behavior, and how people from other cultures may see you. Understanding why we do things in certain ways, how we see the world, and why we react the way we do is an important part of being culturally aware. Cultural awareness can improve performance in culturally diverse organizations or when an organization's customers are diverse.
Number 6. Communicate efficiently and openly with parents or guardians of the client. We should listen to what the caregivers would like to see happen in therapy. We should always treat the caregivers and families of the clients we work with respect. This involves including them in intervention planning. If you are an RBT and a parent informs you that they are unhappy with the way you are running a procedure, or they would like to see other skills worked on, you should inform your BCBA of this conversation and work with them to find alternative ways to provide treatment in a way that will make the family more comfortable. If the family comes to you or the BCBA with a goal that is not able to be worked on in the moment, be honest with the family. It is important to acknowledge their ideas and provide rationale about why working on that goal may not be the best idea at that moment. If you choose to ignore the family's requests and avoid providing an explanation, you pose the risk of making them feel left out and as if you do not care about their thoughts. While discussing issues with parents, you should always use language that is easy to understand. This involves avoiding behavior analytic jargon. For example, rather than saying, "That is going to lead to an extinction burst that may be hard to handle," you could say, "That might lead him to headbang more frequently, which could be dangerous." It is important to remember that the BCBA is responsible for making changes to programming. You should only implement changes to programs after your BCBA has written them and trained you on how to implement them. As always, tell your BCBA about feedback you receive from your clients and their families. Keeping this line of communication open is very important. Number 7, increase the client's involvement in therapy. We must remember that our clients also have points of view that we should take into consideration when planning interventions. If a client is able to communicate their goals with you, you should prioritize these goals whenever possible. By including them in decision making, you will build rapport and increase the client's satisfaction with therapy. If you have a nonverbal client, you can teach them skills that will help them become more involved in intervention planning. One method to use to help clients become more involved in therapy is to allow them to make choices. You can do this by teaching them to select the order in which they complete activities. This can involve showing them a list of icons that represent certain activities and having them choose one by one which one they would like to do. Additionally, you can have all clients choose what reinforcers they use. By identifying and using reinforcers, you can increase the likelihood that the client will actively engage in therapy and make more progress. If a client communicates that they are unhappy with the procedure or treatment approach, it is critical that you change your approach. The client has the right to advocate for themselves in their viewpoint and should have a large impact on therapy. Therefore, we should base interventions whenever possible off of their preferences. We are now going to answer the following question. Make sure you write this down on your blank sheet of paper for homework. A client you are working with who is nonverbal has begun engaging in new problem behaviors when presented with a puzzle that they previously used to complete. Every day, the problem behavior has gotten worse and has evolved from just crying to headbanging. What should you do? A. Continue presenting the demand. B. Switch out the demand. C. Prompt the student through the demand. Or D. Ignore the student until they comply. I'll give you guys a second to write the question and think about what answer you would choose. The correct answer is B. Switch out the demand. It should be noted that this is something your BCBA should approve of first. The emergence of problem behavior can mean a variety of things. For starters, if the task is too easy or too difficult, you may want to modify the task by accommodating schedules, adapting response definitions, implementing skills assessments, etc. Another possible cause of increased problem behavior is if the reinforcement schedule is too thin. If this is the case, you should consider modifying the reinforcement procedure. Some possible modifications to make to the reinforcement procedure include having the child choose the reinforcer, increasing the reinforcement schedule, or increasing the amount of breaks provided. If the prompting procedures are reversive, you may want to evaluate and individualize the prompting procedures. Some clients find physical touch or physical prompting aversive. Therefore, using a method such as picture prompting or vocal prompting may be a better method to use. Finally, if the teaching procedure is aversive, you would want to individualize teaching procedures to better fit your client. An important final note is that you should never do this without your BCBA's permission, as they are the person responsible for the programming. Number 8, we should focus on important skills. When selecting goals, we should focus on skills that are important to the client's everyday life. One example of an important functional skill is communicating. For example, you can teach an individual to vocalize their wants and needs, exchange icons, use sign language, or any other communication device. You also could focus on teaching the individual to dress themselves. By teaching them to dress themselves, they can get themselves ready in the morning and ready for bed at night. Teaching a client to feed themselves is also a critical functional skill. This could be in the form of teaching them how to use utensils, such as forks and spoons. It also could involve teaching them how to cook some of their favorite foods. Another skill to focus on would be using the bathroom. Bathroom-related behaviors include potty training, teaching them how to change their own diaper, washing their hands, etc. The last important skill I would like to mention is brushing your teeth. Poor dental hygiene can lead to a variety of dental issues that can be painful and expensive. By teaching an individual how to brush their teeth and complete other hygienic activities, you will help prevent medical issues in the future. When teaching these skills, you should consider 3 main steps. The first is acquisition. When teaching a new skill, we must identify what methods would work, what the goal of the intervention is, etc. We have to have carefully thought out plans for acquisition of skills, and we must implement these plans with accuracy. We also must be flexible in our planning and alter interventions when they appear to be failing. A second step that is crucial is generalization. Generalization involves a client engaging in a behavior across different places, people, stimuli, and so on. If we teach a client to use the bathroom independently while at the clinic, but do not teach them to use other bathrooms, we have failed to ensure they generalize the skill. We should plan for generalization by using stimuli that are similar to the client's home and other environments. For example, if the parents of a child always buy soap dispensers that use a pump for the bathroom, we should not teach a child using an automatic soap dispenser. Instead, we should use a soap dispenser similar to the one they use at home. It also may be beneficial to take them to different bathrooms around the clinic or around the community during community outings. This will teach them how to adapt to new bathrooms while omitting the same skills they initially learned during therapy in the clinic. A final step to consider is maintenance. Maintenance involves ensuring that the skill maintains over time. If you teach a client to engage in a specific skill by using reinforcement or other contingencies, and then remove these contingencies, it is quite possible that they will stop engaging in that skill in the future. Because of this, we should always have plans in place for maintenance. One idea is to have once a week, or however often you find fit, providing reinforcement for independence while in the bathroom, using utensils independently, or other functional mastered skills. Number 9, confidentiality. You should never share information about your client with people who are not authorized to receive information. Additionally, if you are discussing your client with someone who is authorized, you should only do so in a professional manner. For example, if you are talking with your BCBA, you should only discuss intervention-related issues, and you should avoid gossiping about things that are not beneficial to services. You cannot discuss your client with friends or family. You are not permitted to discuss client-related issues with your personal friends or family at any time and for any reason. You also should never discuss information pertaining to your client with individuals at your company who do not work with your client. For example, if you and your friend both work as RBTs at the same company, you cannot share information regarding your client with your friend. Your friend is not involved in their services and therefore is not authorized to receive information about them. Your client has a right to privacy. Therefore, they have control over who can and who cannot receive information regarding their services. This is something that you should always respect. Number 10, protect their rights. We want to ensure we are always protecting the rights of our clients. This involves informing them of their ability to report unethical behavior. By making them aware of their rights, they may feel more comfortable moving forward with services, as they have the necessary information on how to deal with an incident if it were to occur. You should let them know that there are several ways they can report misconduct. One method is to remind them that there is always an open line of communication between them and their BCBA. If there is ever any concerns they have regarding programming, the RBT's performance, etc., they can always reach out and discuss matters with their BCBA. Another method would be to talk to the head of the company or clinic. If the parent has complaints regarding the BCBA or just feels more comfortable talking about matters with the owner or higher-up management of a company, they can always contact them and set up a meeting. And finally, make them aware of the option to report to the BACB. It is beneficial for parents to know that there are regulations that BCBAs and other professionals working in behavioral services must follow, and failure to follow these codes can lead to consequences by the BACB. Informing caregivers, parents, and clients of these rights is very important. Number 11, provide an engaging environment. Providing an engaging and safe environment is very important when conducting behavioral services. The environment provided should be least restrictive. Least restrictive environments are ones where the client is allowed free movement, access to preferred activities, and so on. We should never restrain a client or forcibly contain them to an area. Instead, we should allow them free access to movement, access to areas, and access to preferred activities. We also always want to ensure that we never hold their bodies, arms, legs, or other body parts forcibly in place. This can be dangerous and produces a very restrictive environment. An engaging environment is one that involves a variety of things. Number 1, leisure activities. We want to ensure that our clients are receiving a mix of learning opportunities and opportunities to engage in activities that they enjoy. By providing access to leisure activities, such as doing puzzles, coloring, or whatever is age appropriate or preferred for that client, we are allowing them opportunities to engage in activities that relax them and are enjoyable. Similar to the previous bullet point, we want to ensure that we have effective reinforcers. Reinforcers are items or activities that increase a client's motivation to complete learning opportunities and activities. You should reevaluate the reinforcers you are providing to your client if the client appears to be disinterested or does not engage with the item. We also want to maintain client dignity by including toys that are age appropriate. If you are working with a 15-year-old who has shown interest in items such as board games and looking through books, we should not restrict their reinforcers to Barbie dolls and pop-up toys or other toys that are used for toddler-aged children. We should allow that client access to the items they prefer and to items that are age appropriate. We also want to ensure that our environment has learning materials. A lot of procedures used by behavior therapists involve materials that facilitate learning and student engagement. By having these materials readily available, we can ensure we are including learning opportunities as frequent as possible. Overall, an environment is engaging and safe when we ensure our clients have full control over their bodies, we provide leisure activities, effective reinforcers, and learning opportunities. Now we are going to discuss a list of things that you should never do while working with your client. Number 1, you should never talk down to or belittle a client. Even if a client is nonverbal, we are unable to assess their ability to understand language. Therefore, even though they are nonverbal, they may still be able to understand you. It is also possible that other professionals, family members, children, or others may overhear you while you are talking unprofessionally. Belittlement or negative talk is never acceptable. All clients deserve our respect in both our actions and our words. While there are obvious examples of belittlement and negative talk, there are also examples that you may not recognize are inappropriate. For example, saying something like, "You are so difficult to work with," or saying something like, "You're so frustrating sometimes," are statements that are inappropriate and unacceptable. They belittle the client and place the blame on them. In addition to vocal statements, behavior therapists also must avoid nonverbal behaviors that can show aggression or mistreatment of the client. For example, loudly sighing while working with a client. This may be common when a client is engaging in problem behaviors or after they make an incorrect response. However, we must remain professional and avoid showing nonverbal cues that are inappropriate or show unnecessary disapproval of our clients. In addition to loudly sighing, another nonverbal behavior that is not okay is rolling your eyes. Both of these behaviors may affect client responding if they pick up on how you are behaving. It also will affect the way those around you view you and your professional behavior. Overall, it is important to be aware of both your verbal statements and your nonverbal behavior. Instead of making inappropriate statements or nonverbal cues, here are some steps you should take. First, you should be aware of your behavior. In a field where we constantly analyze behavior, you should always be analyzing your own behavior. While it is okay to think about how frustrating a situation is, it is never okay to vocally state it or show it through body language. This should be done when you are and are not being observed. Just because you are alone with a client does not mean it is okay to act in a way that you would not if your supervisor or another individual was watching. One strategy to use would be to ask for a break if you are feeling overwhelmed. It should be noted that this may not be possible while providing in-home services or if you are working at a center that has limited employees. However, if possible, you can always ask a fellow worker for a few-minute break. You should also always be open with your BCBA about issues you are facing. Your BCBA has experience dealing with a variety of behaviors and can be very informative on what coping methods can help you stay calm in stressful situations. For starters, they can inform you about and set up pairing opportunities. It is common for clients to engage in problem behaviors when they are working with a technician that they have not paired well with. If this is the case, having some time set aside to continue pairing and building rapport with the client is important. Your BCBA can also come up with some antecedent strategies to prevent problem behaviors. For example, if a client often engages in problem behaviors when they lose interest in a toy, your BCBA may have you do more frequent preference assessments. By doing this, you can work on pairing and prevent problem behaviors simultaneously. You are working on pairing because you are presenting new toys frequently, and you are preventing problem behavior because you are presenting new toys before the client loses interest in their current toy and begins engaging in problem behavior in order to gain access to a new toy. The BCBA also may come up with some consequences for the problem behavior. It should be noted that you should never provide negative consequences without first discussing and receiving training and approval from your BCBA. Negative consequences could include a short timeout, removal of toys, and other consequences. Another thing you should never do is talk down to or belittle the parents and/or caregivers of the client. It is very important that you always respect everyone you work with. This includes fellow RBTs, BCBAs, speech therapists, occupational therapists, and other professionals working at your center. However, this also includes the parents and caregivers of the client with whom you work with. You have a professional relationship with the caregivers of your client and should always remain professional while interacting with them. You should do so by taking their suggestions and viewpoints seriously. Even if they have a different idea from the one that you have, it does not mean that you can just dismiss their ideas. Instead, you should collaborate when possible with the families of your clients. This should be done with your BCBA present. It is also very important to avoid putting blame on or making assumptions about the families with whom you work with. If parents are unable to attend parent training or do not complete homework that the BCBA asks them to complete, you should never jump to conclusions and begin judging them. Remember that they have other obligations, whether it's work, caring for the siblings of your client, caring for your client themselves, and so on. Rather than judging them, provide them with support when possible and help your BCBA come up with ways to increase parent or caregiver involvement. Some additional steps to take include talking with your BCBA if parent-related behaviors are hindering interventions. For example, if the parents are constantly coming into the room during in-home sessions to provide the child with attention, you may want to inform your BCBA. Your BCBA may talk with the family and discuss why this is preventing learning. You also should inform your BCBA about any suggestions or complaints the parents bring to you. If they suggest a skill they would like to work on, you should never ignore their suggestion. Instead, let your BCBA know that the parent communicated this want to you. Additionally, if the parent is unhappy with services and makes comments to you regarding their dissatisfaction, make this aware to your BCBA. They can communicate with the family and come up with ways to increase their satisfaction with services. And as always, come up with coping methods to deal with your stress. Some coping mechanisms can include breathing exercises, leisure activities, and so on. Number 3, you should never allow your personal opinions to interfere with treatment. If you disagree with a belief, lifestyle choice, or other factors related to your client or their family, you should not allow it to interfere with how you provide services. This includes religious beliefs. For example, if the RBT holds a different religious belief than the family, this should not affect services. The difference in religious beliefs should not affect how the RBT interacts with the client. Additionally, you should not allow differences in political beliefs to affect services. If you work with a client who smokes cigarettes in the home, this is something that you should not allow to affect services. Remember, your client is the child, teenager, or adult with whom you provide behavioral services to. Therefore, their caregiver's choice to smoke cigarettes should not affect the way that you interact with the client. You also should not treat low-income and high-income families differently. Once again, your focus should be solely on the success of your clients and not on other factors that are out of your client's control. These are just some examples of lifestyle choices that you may disagree with while working with families. Keep in mind that there are other lifestyle choices that you should not allow to affect behavioral services. If you believe your differences in opinion or lifestyle will affect your ability to provide services, it is important that you inform your BCBA. Additionally, differences in lifestyle choices or beliefs should not affect treatment unless they are negatively impacting the child or putting them in danger. For example, if you are providing in-home services to a client and recognize that their parents tend to smell of alcohol and appear drunk, you must inform your BCBA and take steps to ensure the safety of the client. Number 4, you should never take videos or photos of your client without permission. This breaks confidentiality and invades the privacy of your client. This includes putting the client on your Snapchat, Facebook, Instagram, or other social media. It also involves taking videos or pictures for you to view later on your phone. Even though you may want to have those memories with your client saved, it is unethical and breaks confidentiality. To take videos or pictures, you must receive permission from a parent. This permission should be in the form of written consent. Verbal consent is not adequate as there is no proof that it was ever given. By having paper consent, you have a record of the parents or caregivers agreeing for the client to have their photo taken or video taken of them. Once the parent has given permission, you still have to respect who they gave permission to. For example, if the parents agree to allow videos to be taken of the client for research purposes solely, you should not use those photos or videos for advertising purposes or to show to your family and friends. Only the people that the parents gave permission to should receive and have access to the photos or videos of the client. It should also be noted that this involves taking videos of the client during intervention implementation. Even if you want to take a video just so you can show your BCBA a skill deficit, problem behavior, etc., it is not ethical to do so without written permission from the caregiver. Number 5, you should never use aversive stimuli unless it has been approved by the BACB and your BCBA has explicitly trained you on how to do so. As a reminder, an aversive stimulus is a stimulus that decreases the frequency of the response it follows. The following are some examples of aversive stimuli that you should never use. Number 1, spanking. In addition to spanking, Any physical touch that involves force should never be used. We should never be physically touching our clients in a way that could hurt them. Number 2, loud noises, such as using a buzzer or other loud noise that is aversive to your client. Number 3, yelling at your client. For example, if your client gets a response incorrect, yelling no or other disapproving statements. Aversive stimuli are never appropriate unless the BACB has approved them. If that does happen, you should ask for explicit training on how to use the aversive stimuli. Without receiving training, you may misuse the stimuli and endanger your client. Number 6, you should not work with a client if you have a skill deficit that prevents you from providing adequate services. For example, if you are working with a client that is exhibiting behaviors, skill deficits, or other behavior-related problems that you are not specifically trained on or have not had specific experience with, you should not work with this client until you take steps to mediate this. If you have no prior experience with a severe problem behavior, you are not competent in that area and are unable to provide adequate services. This inexperience can place the child in danger and can cause you to act unethically due to lack of training. Additionally, those working with the child should be people who are engaging and competent. If someone shows a strong disinterest or dislike for children, they should not work as an RBT for children. People who work with children, for example, should be those who are excited to work with children and engaging. Clients have a right to effective treatment. Having a technician who is incompetent will lead to ineffective treatment, as the technician will not be able to provide services adequately. Additionally, having staff that are not excited or interested in the child or client can cause poor services. Steps you can take to combat the last issue include seeking supervision and training. It is important to be upfront and honest about your past experiences. If you know you lack competence or skill in a certain area, you should inform your BCBA. Everyone has to go through new experiences to learn and become better at what they do, so you should not feel scared to be honest and upfront about your lack of experience. Doing so will allow your BCBA the opportunity to train you and help you gain knowledge. To gain competence, you can attend workshops, engage in role-play activities with your supervisor, read literature that pertains to your client, and so on. However, doing any of these alone does not mean you are now competent in that area. Competence comes after intensive training and supervision from your BCBA. Your BCBA should watch you perform the new skill and ensure that you are truly competent before you can work with the client alone. Here is a list of the articles that we used to make all of our previous slides. Now we are going to review ethics. To do so, we will be going through a few case study examples that deal with common issues you may face as an RBT. For your homework questions, please write the case study number. You do not have to write the entire case study or case study questions specifically. The number that pertains to the case study is all that you have to write. You should fill in a question for each case study that we are about to present. Here is the first case study. You have been working with the same client for the past 2 months. Previously, you were using most to least prompting to teach imitation. Recently, your BCBA switched the intervention to involve least to most prompting instead. While running sessions with your client, you notice they are consistently engaging in incorrect responses when presented with imitation trials. What should you do? A. Switch back to most to least prompting. B. Continue using least to most prompting and inform your BCBA about the client's performance when the session ends. C. Stop running trials and end the session. D. Switch to most to least prompting and inform your BCBA about the change in programming once the trial ends. I'll give you guys a moment to look over the answers and think about what you would do. The correct answer is B. Continue using least to most prompting and inform your BCBA about the client's performance when the session ends. As an RBT, your role is to directly implement procedures with clients. Your role does not involve writing or choosing interventions to use with your clients. However, your BCBA or other supervisor will most likely really appreciate your feedback and ideas. It is important that you always keep your BCBA in the loop. Since they typically have a larger caseload, they are not able to observe every trial or learning opportunity that you complete with your client. Doing things such as writing objective session notes or having a list of things you want to discuss with your BCBA during a one-on-one meeting will help facilitate communication about client progress. Case study number 2. You have been working with Hannah for the past 2 months. One of her main programs involves learning to trace the letter A. Hannah has made minimal progress on the procedure, and it is becoming increasingly frustrating for you to have to run it every session. What should you do? A. Bring up your concerns to your BCBA. B. Record correct for all responses so that she masters the program. C. Continue running the tracing program until further notice. Or D. Report your BCBA for poor programming. I'll give you guys a moment to look over the answers and decide what you think you would do. The correct answer is A. Bring up your concerns to your BCBA. If you are ever uncomfortable running a program or feel as though you are observing something that data does not show, for example, the child appears disinterested or seems distracted during this particular activity, you should always inform your BCBA. Informing your BCBA can help keep them in the loop so they can consider other teaching methods. Additionally, it also may prompt them to observe a session where this particular procedure will be used. It is important that you do not try to falsify data in order to help your client master a procedure. A lot of programming builds off of previous programming. For example, if your data shows that the child can reliably trace the letter A, a new procedure may be put in for the child to independently write the letter A. Without having the prerequisite of being able to trace it, the child will continue to make minimal progress. Even if you are working on a skill that will not be used in future programming, falsifying data is never acceptable. It is a violation of the RBT Ethics Code and could lead to a variety of consequences, such as losing your employment, losing your certification, and so on. Case study number 3. You are running imitation with your client, Gina. When presenting the demand, do this, and tapping your nose, Gina taps her mouth. You are unsure if this approximation would be considered correct by your BCBA, so you look at the data from the day before, when another technician was working with Gina. You notice that all imitation responses of tapping nose were counted as correct. Which of the following rationale is correct? A. If all of Gina's responding was counted as correct yesterday, that must mean that the approximation of touching an area around her nose is considered correct. Therefore, I should mark it as correct. B. The technician yesterday was clearly falsifying data since Gina is only touching her mouth when I present the demand. Therefore, I must report her to my supervisor. C. Even though Gina's responding was counted as correct, I still don't know if her tapping her mouth would be a close enough approximation to tapping her nose for it to be counted as correct. Therefore, I'm going to mark it as incorrect. D. I am unsure of what to do. Therefore, I am going to wait to clarify this with my BCBA before running more trials. I'll give you guys a moment to look through the answers and decide what you think you would do. The correct answer is D. I am unsure of what to do. Therefore, I am going to wait to clarify this with my BCBA before running more trials. Just because data shows that the child was responding correctly yesterday does not mean that the approximation he is making today is correct. The only way to know if his response is correct is to check in with your BCBA and ask for further explanation. You should not accuse the other technician of falsifying data, as there are plenty of reasons why their session may look different than yours. One reason could be that they have more instructional control than you do. Instructional control refers to how well the client complies with demands while working with a particular person. Instructional control can be affected by a variety of things, such as how much the technician has paired themselves and is reinforcing to the client, the environment, the child's motivation that day, etc. Another possible explanation is that the technician received more explicit training than you did. The BCBA may have sat down with them and modeled how to run the procedure or explicitly stated what an incorrect versus correct response would look like. Finally, the client may have been more motivated to complete the activities the day before. Motivation can be affected by what type of reinforcers you are using, the client's sleeping habits, and other factors. Finally, you should not count the trials incorrect just because you are unsure of what a correct response is. It is important that you receive further instruction from your supervisor before taking data. We are now going to continue discussing case study 3. As you may remember, in case study 3, the technician was confused on what a correct versus incorrect response was. What do you think the BCBA should have done to prevent the technician's confusion? A. Completed IOA data. B. Provided an operational definition. Or C. Run the imitation procedure themselves. I'll give you guys a moment to look over the answers and determine what you think is correct. The correct answer is B. Provided an operational definition. An operational definition is a thorough explanation of a behavior that is written in observable terms. For example, instead of saying that a client becomes angry or frustrated, an operational definition will explain what those emotions look like in observable terms. For example, instead of saying angry or frustrated, an operational definition may discuss how the client hits their closed fist against a table or does other problem behaviors. Having an operational definition allows for technicians to reliably record data. As we saw in the previous example, the technician was unsure of how the client's other tech had received such different responding. If they were using the same operational definition, they would have been able to take data reliably and would not have had to look at each other's data or ask for further clarification. IOA refers to Inter-Observer Agreement. IOA is an important measure to use to ensure that technicians are taking data reliably, are counting incorrect versus correct responses the right way, and so on. Taking IOA data could be beneficial in the future as it could help the BCBA determine if trials are being conducted correctly and if data is being collected correctly. As for this particular case study, the lack of IOA data was not necessarily the issue. The issue was the technician did not have a clear understanding of what the target response was. Case study number 4. You work at a company that provides in-home services to clients who have autism spectrum disorder. One of the rules of the company is that you must keep your shoes on at all times during services. You begin working with a family that requests that you take your shoes off at the door. What should you do? A. Inform your BCBA about the differences in rules. B. Ask the family if you can purchase a pair of shoes that will only be worn in their home. Therefore, they will be clean. C. Take your shoes off when you go to their house. D. Ignore the family's requests. I'll give you guys a moment to look over the answers and decide what you think you would do. The correct answer is A. Inform your BCBA about the differences in rules. You should never ignore or dismiss the requests of parents. They are allowing us to come into their homes, and we must be respectful of the rules that they would like us to follow. Additionally, we also must ensure that we do not break company policies. Company policies are put in place for specific reasons and should never be ignored. Rather than ignoring the parents' requests or going against the rules of your company, you should inform your BCBA. When discussing the matter with your BCBA, it may be important to mention a few concerns you would have if you were not allowed to take your shoes off while working with your client in their home. One major concern is how it could affect your client-therapist relationship. By telling the family that you cannot take off your shoes, you may offend them or make them feel uncomfortable. You and your BCBA can discuss ways to navigate this sort of issue and perhaps set up a more formal meeting with the client's family so you can explain further into detail. If after discussing the matter with your BCBA, they still tell you that you cannot break company rules and must keep your shoes on, you should inform the family during your next session. When doing so, offer alternative solutions as an attempt to make them feel more comfortable. For example, you could offer to wear a different type of shoe while in the home. Case study number 5. You have been providing in-home services to a 5-year-old child for about a month. Whenever you provide services, the only people who are home are the client and their grandpa, who does not speak the same language that you do. One day, he waves goodbye to you as he leaves the house. Now it is just you and the 5-year-old client present in the home. What should you do? A. Continue providing services until the grandpa returns. B. Bring the child to the clinic. C. Contact your BCBA. D. End the session since you are not allowed to be alone with the child. I'll give you guys a moment to review these answers and determine what you would do. The correct answer is C. Contact your BCBA. You should never be left alone with a client while providing in-home services. The guardian or parent should be somewhere in the house in case anything happens. Your role as an RBT is to provide behavioral services for a specified length of time. If the guardian leaves the house, You would not know when they were going to return home. You should never leave a client alone in their home unless there has been discussion and agreement to do so. Even if the individual tells you when they will be back, you cannot know for sure that they will be back at that time. Extenuating circumstances, such as a car accident, a GPS running out of battery, etc., could prevent them from returning before the end of the session. If they do not return on time, you could be left alone with the client until they do return. This would leave you in a babysitter position rather than an RBT position. Additionally, if you have other clients, meetings, or other commitments directly after that session, you run the risk of being late to or missing them entirely. You should never transport a client to a new location without consent. It is a liability to have a client in your car without consent. Driving always runs the risk of car accidents or other issues. Therefore, you should never assume that it is okay to provide transportation to a client without first receiving written permission from their guardian. If you call or text your BCBA, they can give you further instruction. It is likely that they will contact one of the family members or come to the session to assist. Case study number 6. You are at a doctor's appointment and the doctor asks what your current job is. When you tell her that you are working as an RBT, she tells you that her son was recently diagnosed with autism spectrum disorder, and she has been researching what types of interventions would be the most beneficial for him. She asks what your opinion is and also asks if you'd be willing to come to her home to assess his skills and provide services. What should you do? A. Go to the family home and work with the child. B. Ask her to bring her child to your clinic so you can work with him there. Or C. Tell her that you are not qualified to assess his skills / cannot provide services without a supervisor. I'll give you guys a moment to look over the answers and determine what you think is correct. The correct answer is C. Tell her that you are not qualified to assess his skills and cannot provide services without a supervisor. It is required by the BACB that RBTs work under the supervision of a qualified supervisor. This could be someone who is a BCBA, BCABA, BCBAD, and so on. This ensures that all behavior analytics services are being overseen by someone who has met certain qualifications, such as obtaining a master's degree and passing a test. Additionally, working for your doctor's family would create a multiple relationship and conflict of interest. Since your doctor provides services for you, and you would now be providing services for them, you could find yourself in an uncomfortable situation. For example, your doctor may offer better services, such as free physicals or prescriptions, in exchange for better services with their child. On the other hand, you may feel obligated to provide better services to this client because you are receiving services from their mother. All in all, it is always best to avoid a multiple relationship. Instead, you can provide them information about ABA. You can tell them that it is an evidence-based practice that targets skill acquisition and behavior reduction. Additionally, you can let them know about the company you work for, but you should be honest about your inability to work with them directly. You can explain why the multiple relationship would affect services. If you have any questions regarding the BACB ethics requirements, the ethics codes, reporting ethical violations, and so on, You can go to the following link to learn more information regarding the BACB and ethics. That concludes our discussion of the two following topics: maintaining client dignity and a review of ethics. If you have any questions, please feel free to reach out to us.